Hi, everyone. Welcome to our April 6th, 2021 edition of the MIT Enterprise Forum Fireside Chat. We are coming to you, as always, live from New York City, and we're very lucky to have Eren Bali, who is the CEO and co-founder of Carbon Health, with us today. So thank you, Eren, for joining us. Eren leads the Carbon team towards his vision to democratize healthcare and make quality care accessible for everyone. Previously, Eren paved the way to make education accessible by founding Udemy, the world's largest marketplace for online courses with over 10 million students worldwide. In his youth, Eren was a star mathematician, winning awards in mathematics, physics, computer science, and chess, including the International Mathematical Olympiad. And he still loves chess today and plays to unwind after a long day at the office, or maybe a long year at the office. I don't know. So thank you so much again, Eren, for joining us. And if you want to take it away, I know you have some audio visuals for us as well. So we'll start there. Thanks again.
Yeah, thank you, Sammy. Thank you everyone for joining. So today, let me just share my screen. I'll be talking about essentially, I think I'm probably most well known as the person who built two sizable business in industries like education and healthcare, which are both known to be hard industries to crack into. So I'll actually want to talk about my adventures in those two industries. So hi everyone, I'm Eren. I'm the founder and CEO of Carbon Health, as Sammy mentioned. I'm from Turkey originally, so I really have almost all my work can be summarized as like using technology to make some of the essential things accessible to more people. So I first came to Silicon Valley 12 years ago. So I want to quickly talk about my kind of background. So I was born in Turkey, in southeast part of Turkey, in a small village. This was actually soon after the 1980 coup in Turkey. It was somewhat like a troubling time to be there. So these are my two older sisters, and like our kind of small village was a remote place where the biggest problems you observe is like lack of kind of really accessing education was really difficult. So my mother was a teacher, and we moved back to our village because there was pretty much no other teacher in the surrounding area. So she would literally rotate between classes in our primary school, and over time, my older sister eventually got admitted to a college, and my parents kind of bought us a computer, and that made a big difference in my life because just growing up, I was very interested in chess and mathematics, but like in a small village, southeast part of Turkey, you don't really have a lot of places to go. So the computer was for my older sister, but throughout the summer, I was able to kind of use it, and we had access to internet for a couple months, and I started finding these mathematic resources and these IRC channels where people were discussing math problems, and I started kind of studying them, kind of working those problems. And long story short, I ended up winning the gold medal in Turkey's national math Olympiads and a silver medal in international Olympiads. That became my kind of ticket to eventually Silicon Valley and kind of getting to where I am right now. But I think the more important kind of piece that I always get from my kind of the place I grew up was that the opportunity is not very evenly distributed around the world, but the talent was extremely evenly distributed. In the place I grew up, all these kids were coming to the school every day, like walking miles, like sometimes in the snow, and they wouldn't just want to even miss a day after school. So essentially, they had all the self-motivation, all to try to learn and kind of change their lives, but they really did not have access points. So I decided to start a company to help fix it. So in 2007, I and a couple of my buddies, we started a company in Turkey, which became Udemy today. So, but it was originally called Noben. It was meant to be a kind of social network for teaching and learning. So we started in 2007 in Turkey, and it had the kind of same idea with Udemy, which was really making it very easy for anybody to share their knowledge. But started the company in Turkey where we had no access to capital, no access to kind of influencers who can actually attract more people. So it was the right idea, but the wrong time, wrong place. And also, even in terms of the medium, we did not have the kind of right model. So this is actually the little first office of Novent, which eventually became Udemy. So we had to shut down the company in Turkey, moved over to Silicon Valley. It took us really 3 years or so to just get really up on our feet in Silicon Valley. But I mean, I think this. I took the screenshot from a year ago, but Udemy ends up becoming the world's largest platform for online education. At this point, we probably have more than 60 million users, learners, and probably close to 100,000 instructors. Really teaching anything from photography to programming to music to just a broad audience of people. So it was essentially really the kind of long and tough ride, because just coming to Silicon Valley, kind of getting access, even kind of being able to hire teams, getting access to capital, these were extremely hard. So when we first came, I think somewhere around a couple hundred investors passed on the idea. The common concern was that generally the Silicon Valley audience did not think anybody would be paying for, like, spending their own time and own money to learn a skill. So they thought learning would only be could only be monetized through certification, diplomas, and even the subjects they were looking for were maybe like learning machine learning from a Stanford professor was what they really would be interested in. So this idea of like really pragmatic, practical skills that you learn for everyday people, it wasn't the type of problem they were observing themselves, because again, Silicon Valley doesn't really represent the most of the population, most of the world. So they were over-indexing on type of the things they wanted to learn. But Udemy's differentiation was just focusing on the kind of practical skills, so that somebody could learn some Excel and find their first white-collar job. Like people learn programming and start making some amount of money by making websites for the bakeries on the corner, right? So that is actually a far bigger need in the world, which was not truly understood by Silicon Valley investors and Silicon Valley founders by and large. And that actually, that almost contrarian view like made the company very successful, because we just focused on the value we were creating, and we end up growing like somewhere around 20% month over month for like our first 5 years. And then while we were the underdog on the online education space, ended up coming out as the winner. So, and obviously, like once you get the winner, this is kind of a shot from one of my magazine covers. Just want to talk about like how I transitioned to my current company, Carbon Health. So I think at Udemy, it was interesting to understand that when you pay attention to the problems that an average person is having, often you realize like a lot of Silicon Valley does not really pay attention to those problems. So for me, like education and healthcare are some of the most critical things that you want to make more accessible. And I got convinced about really a couple things in 2015. One is that healthcare is one of the most complex service industries. So you can't really operate this efficiently without technology. If you think about healthcare, it is far more complicated than transportation, far more complicated than food. And even transportation and food delivery have recently been disrupted by technology companies. So I was very convinced this is the type of the space that really needed the technology, like a full stack technology approach. But I was also disappointed that there were startups working on healthcare delivery, but they were all focused on young, affluent customers. Essentially, hundreds of startups were trying to create a better healthcare provider for Google employees. But there wasn't even a single company focused on an average teacher, an average retail worker in this country. Like really for the mass market US population, the problem was massive, and technology companies were completely ignoring them. So similarly, people were really just overly indexing on their own problems. So, and I kind of like my history of coming to a conclusion was really just going back, right? So this is my mother is on the right here. So she had a disease called neurosarcoidosis. All of a sudden, when I was the CEO of Udemy, still in 2014. So she had a full body stroke, and we didn't really understand what was happening. So we were going from doctor to doctor. And then my sister is a physician, so she extracted my mom's medical records from all different hospitals, the different doctors she was seeing. And I was actually observing that the doctors were all doing the same things. So they would listen to the story, they would take their notebook and just really write a bunch of notes about like every page they are seeing. They look at the pages and take a couple of words into their notebook. And I asked my sister, I said, what are these doctors writing their notebooks? Like, it looks, I mean, we are giving them thousands of pages and DVDs and MRIs. And she said they're making a chronology of the case. And my naive response was like, why are we not giving this in a chronology in the first place? Like, if that's how they think about the medical records and like providing care. So it just became like, in that anecdote, it just became very obvious to me that the technology, the tools that we give doctors were not really designed for them, designed in their perspective. They're just obviously designed for some other administrative need. So, and while my sister was kind of running the process and talking to different physicians, I just made a sketch about how I would build healthcare software if it was up to me. I just kind of said, okay, like there is this problem which I call the case, and there are some chicken planes and vitals, and let's just capture all of them as data points, all the imaging, all the medication, the different treatments, medical imaging should be just overlaid in a kind of nicely presented way. So I thought, like, if this is how doctors are looking for care, like, why don't we already do it this way? These were my sketches, but at this moment, I'm still the CEO of a kind of 600 people growing technology company in education space as well. I was not really seriously thinking about healthcare. So, and then I just went back to the United States. My mom's, I think the physician number 13 correctly diagnosed the problem. She started recovering. So there was no sad story there, but it's still like the fact that the most critical resource of any country was getting the worst tooling you could ever imagine. That kind of got stuck in my head. I started making some sketches about how you could make doctors more effective, more efficient at their jobs. And like we just really I brought some kind of designers, some physicians together, and we started really almost think tanking about kind of like how to make doctors more effective. We started making a lot of sketches about this kind of cases, sharing medical records, and all those we looked at different directions. And eventually, like, we were thinking about maybe partnering with existing practices to kind of make a change. And really what struck me was what I said a couple minutes ago, which is like there were technology-enabled healthcare providers which would want to use our software and maybe make a difference, but they were all exclusively focused on affluent customers. They really just, nobody in the technology space paid attention to just average person. There were also some startups in the kind of focusing on the low-income, high-risk category, which was another lucrative market. But I realized that the mainstream healthcare market is considered to be a kind of completely unprofitable industry, and that's why like nobody's really tackling it, because people assume that it's impossible to make money, and they just ignored majority of the population, and that just didn't make sense to me. So because I believe that actually like the technology is most interesting when you are making something more efficient, more accessible. So and we started kind of thinking about this model where we would have a full stack healthcare provider. So we'll just combine the best design, best clinics, best like highest quality clinical care with the best technology platform to provide an extremely attractive, extremely compelling customer experience. And then to really kind of fix this problem, what we had to do was become our own market force and just make this experience available at a much lower cost, right? And this is the type of thing that to me, like where technology is relevant, because when you're providing care to affluent, high-income people, you are differentiating by having luxury offices, having long appointment times. So that's actually less interesting as a technology problem. But when you have to do high frequency, high scale healthcare at a good quality, that's where the technology matters the most. So to me, essentially, the mainstream healthcare becoming the biggest area where technology could make a difference and also getting the least love from technology companies, it just kind of told me that there was a kind of massive opening here. So we started in a very kind of unusual way. So um, I stepped down from my job at Udemy, brought on a team. So we opened an office and we actually launched an actual physical primary care clinic, and we started seeing patients. And I made it forbidden to even look at third-party healthcare software. So that's really how Carbon Health started. We just said, let's just start everything from first principles, right? So how do you and then because we understood that the legacy healthcare software was really not designed from the perspective of doctor nor the patient, and that was obviously failing the healthcare industry. So to really build the right software platform, we had to just really be free from the baggage of legacy systems. So and really what we started working on was like whatever we thought the patients and the provider needed the most. And if you just really don't worry about kind of how systems currently work, it was very simple. Patients want to use their phones. They want to onboard themselves digitally. They want to book their appointments digitally. They just really want to handle all of the customer experience touch points from their smartphones. And then when they come to a physical location, they want compassionate staff. And similarly, what doctors wanted was also very similar. Like they just didn't want to spend any time on something that's not medical decision making. So to really just like create this world where patients are getting very efficient, very digital first modern healthcare, and the doctors not wasting like even a second of the doctor's time, it's actually kind of pushed us to really think from the first principles. So, and that's what this is a common idea. I mean, obviously, I did not make up the idea of first principles thinking. So, but I think this is in a lot of these industries which don't get disrupted, and then eventually somebody breaks through. You actually see a very similar situation. So, I was watching this interview from Elon Musk like maybe I think 6 or 7 years ago. So, I think the way he started SpaceX was very straightforward. So, when you hear that it like costs $500 million to kind of build a rocket, and a lot of people think, okay, it is what it costs, and NASA knows how to build rockets. We don't know, but I think what he did was really just kind of understand all the ingredients of what makes the rocket, and then just sum them up, put all the R&D force, and they realized that it just did not like the rockets did not really have to cost $500 million. It could be $50 million. I think similarly, sometimes we look at how things work and just overestimate the structural things and just don't really think about how things could work in a completely different way. So US healthcare is extremely expensive. It costs $2.5 trillion just to do the healthcare delivery, right? So, and it really is expensive because the business model of existing hospitals is creating regional density and using their regional density to create negotiation leverage and charge as much as possible. Because they have fixed assets, their business model is all about like their margins are all about how much they can charge because they're physically limited with the space they have. So, and when they are able to charge more money, then they use the profits to buy more providers to become even bigger monopolies regionally and then charge even more. And this actually has lasted for a long time. And eventually what happens is when you are very profitable, when you have a lot of profits to spend on things, you start becoming fat. You start becoming bloated. You start doing a lot of inefficient things. You start spending all those profits in different areas, which doesn't really make sense. And we come to this point where United States healthcare has been becoming 6% more expensive every year, despite the fact that diagnostics and technology are getting better. The healthcare industry keeps becoming more and more expensive. And it doesn't even look like hospitals are profitable because historically, they were profitable, but because they could actually spend their profits in useless things, they started doing that and lost all the margins. And when average person looks at the healthcare, they're just really thinking, okay, like we can make this cheaper, but because these hospitals are barely making any profit with this type of rates, and they're charging 3-4 times what they should be charging, but then because they're not profitable, you don't think you will be able to make this more profitable. But if you go start from the other perspective and you say, okay, what is really great healthcare about, right? It's actually very simple. You just want people to be able to get care easily, get care fast. You want them to give you really good digital onboarding, digital scheduling, minimize wait times, give them compassionate care, have them access their medical records, and also do this with a lot of price transparency. These are not things that that need to be costing a lot of money if you start from the first principles. But if you look at other hospitals, other healthcare providers, like it becomes hard to understand how things could be 3, 4, 5 times more efficient than that. So that's really what we have done. So I think like we opened our clinics, we optimized the numbers. Actually, this is just COVID. Let me, and we started opening more and more clinics. And in 2020, we came to a place where our margins, unit economics are really good, and we were able to provide a really high quality experience at a cost structure that is accessible to the entire population. And then as we were scaling the clinics and growing very fast, the COVID pandemic broke. And initially it was a huge risk for our business because overnight people stopped coming to physical locations and clinics. So that would be normally a big challenge. But then instead of really worrying about kind of our challenge, we just also realized as a healthcare provider, we just had the potential role to play in responding to this pandemic. And we started building solutions. I think over the last 12 months, we launched more than 12 different products. We launched the first at-home testing kit. We went to and understood communities to go test them. We built the first mobile trailers. We also built like technology tools, like we launched the first largest clinical data set so that researchers could understand how to study COVID's impact on different labs and symptoms. And so we launched the largest the database of all testing centers so that, both Google Maps and Apple Maps were at one point using our data feeds to find testing. So it's just really, and then more recently, we started getting involved in the vaccine rollout because, again, we started really simple. We said, it takes 3 minutes to vaccinate somebody, but you have to monitor them for 30 minutes. This is going to be a space constraint problem. So like, if you start simple, if you start with analogy thinking, you say, okay, there are 30,000 CVSs and Walgreens, they will be able to vaccinate the entire population, right? So it just sounds simple, but when you think deeper, you realize the monitoring requirements make it almost impossible to do this in traditional pharmacies and clinics. So we just realized that this has to be done in large mass vaccination sites, and we built a solution for a mass vaccination operation. And then those operations end up becoming really effective. So we are now running both Los Angeles and San Mateo vaccine rollouts. We have vaccinated more than 1 million people. And we really have an amazing program there. It's just, this is all about just starting from the technology, focusing on the problem, not worrying too much about how other people do things and really understanding what the right solution would be, and then actually executing it with the team. So that has been kind of the playbook. Again, not too different from Udemy to Carbon Health, but at this point, both companies are very big. So at Carbon Health, after this massive growth, again, as our clinics were growing very fast, and then COVID actually gave us an opportunity to show that a competent healthcare company can make a big difference and actually further expand our brand. At this point, like the Carbon is a 2,000 people company from a couple hundred in 2018. And Udemy is also kind of pretty sizable company. So I think one of the things I want to highlight is that these industries which look unbreakable, are not really unbreakable. They're just a lot of historical legacy thinking that's built into the way they work. And you can't just come in and just think that you have all the answers. You have to be subject to open mind and really understand. You have to first respect the craft that already exists there. But once you understand the craft and what their challenges are, it's as simple as just building what you think is the right solution, deploying it and getting feedback, and just kind of, working on this for like 5 to 6 years also kind of required. That's really essentially my quick story. I want to make them kind of interactive sessions. So, but both companies, Udemy that I started 12 years ago, and Carbon, which I started 5 years ago, they're both fairly sizable companies. With fairly big customer bases. And again, I'm proud of the fact that like we just started both companies with really kind of with this narrow focus, like really just almost an obsession on the problem itself. And we were not maybe as opinionated about what the right solution is. That the right solution came over time. but I think like you just focus on a problem that should be solved, and that actually attracts a lot of other smart people who want to solve these problems, and the rest is just, I guess, just execution. So that's I think that's the end of it, and just a couple of details about the company getting a lot of press, getting a lot of recognition. And we have been really just chosen as the best healthcare provider by almost like every award I can imagine last year. So that's really the quick, just really just accelerated here story of both companies. Um, I would love to open it to questions.
Perfect. Thank you so much, Eren. That was awesome to hear your, both your professional and personal sort of motivations that led you to today. And I was just going to comment that it seems like you like to solve really simple problems. Is that true? No, I'm just kidding. I feel like education and healthcare, I was going to say, are like the two most thorny areas that I know about, at least, from my own experience. And so I commend you and thank you for, pushing your efforts into those two spaces. And it's really exciting to hear about the work you've been doing and are doing. So, yeah.
Honestly, I see them as simple problems, as in the core of the problems are simple. Like
Oh, yeah, yeah, yeah.
it is like people. I mean, somebody needs to build really good care that everybody can afford. Like that was really simple. Obviously, execution is, I guess, complicated, but that complex is something that you can learn over time and solve.
Yeah, absolutely. Yeah, and I was joking with you. I was saying those two areas are not simple at all. So, and yeah, as Eren said, and as Gen is saying in our chat, feel free, anyone who's in attendance, to chat us your questions. We are seeing them come through. So thank you so much to those of you who have already sent in a few.
Yeah.
Maybe what we'll do is actually start with the more granular questions and then kind of go broaden out in scope from there. And so, just on the topic of carbon health and what you were just talking to us about, someone, thanks, Joseph, has asked, what is COVID rehab? Could you talk a little bit about that program?
Yeah, so COVID rehab was again another was one of those things which should be very obvious in retrospect, but everybody so a lot of people are obviously catching COVID, and fatality rates, the discussion, everybody discusses the fatality rate and hospitalization rate, but the reality is, like I mean, all the researchers are showing that COVID makes a drastic impact in your body, even if you survive it. So I mean, your body gets deconditioned. So, and nobody had designed a program to get those COVID positive patients back to their normal health. So
Okay.
if you get hospitalized, we know what to do there. But really, we had been doing, like we meaning like the entire healthcare system has been doing absolutely nothing for people who don't get hospitalized. So we have a fairly kind of well-known pulmonologist and critical care specialist, and we built this multidisciplinary program between mental health and the pulmonary like health, and like just got people signed people who are COVID positive into a program to get them back to their full health. So that was the rehab program. The work to back to work program is also again a simple idea. In as early as March and April, we realized that some companies cannot afford to work remotely. So I mean, we had to build a program for them to work safely. So just everything from really just educating their employees about prevention to also just like doing daily symptom checkers, testing them with different modalities, whether it is on-site testing or at-home testing, and more recently, we're also doing like vaccine health tests. So it's just really good. Like it's a platform we built to help companies operate, and we have, I think, 150 companies with 60,000 employees using that. So like in a daily basis. I think again, it's been interesting to see that when the need arises, you just can't believe how fast you can innovate and deploy and scale these things, right? I mean, I think that the slide I put up was maybe like 6 months old, because the numbers are a lot higher right now. So we have travel testing, we have again vaccination on scale, we have health passes right now, which has been kind of like a very hot topic. Lately, we launched the very first vaccine records. So I think we just have the problem and the team who likes working on the problem to solve them.
Yeah, absolutely. Yeah, thank you for that. And yeah, thank you for answering the other question as well.
Yeah.
So lots of questions coming in, which is awesome. I'm going to go to a question from John. Thanks, John. Do we have data on the demographics of who is using these services? And I'm assuming we're talking about the back to work and the rehab programs that we were just discussing.
Yeah, so the back to work programs were, I mean, maybe 4 or 5 industries became the biggest users. So manufacturing companies was the first big one, biotech companies. We also started getting really big in the film industry, which was kind of an interesting, fun moment. So essentially, at one point, I think all the Hollywood productions, all the shows from like Amazon's and Netflix and Apple, like it's just a lot of them were actually done under our supervision. And that was actually helpful because that was probably one of the very rare things which was a profitable business for us, and then we were able to use that to kind of fund other programs. Yeah, I think like those kind of industries that couldn't work from home were really the key customers for us.
Right, definitely. And speaking of funding and profitability, actually, we've had a few questions come in about financing.
Yeah.
So I'm going to go to the next question, which is about both of your companies.
Yeah.
How and which entities did you raise? How and with which entities did you raise capital necessary to grow?
Yeah, so at Udemy raised a series, I guess, angel round series A, B, C, and D. I guess it was 6 rounds. So I think our first angel round was in 2010, which was $1 million. That was from a lot of angel investors, individual investors. And then in series A was from Lightbank, B was from I think Inside Venture Capital, Northwest. So different investors like Naspers became an investor later. So and we end up raising I think $220 million at Udemy in total over the last 12 years. At Carbon, I think we raised the most recent round was from Dragoneer, which is one of the like best known crossover investor. That was $150 million. And before that, we raised another like $7 million from investors like Data Collective and Brookfield Technology Partners, Builders VC. So I think it's essentially there were similar things, but I would just say like both companies like end up raising a lot of money because they were growing so fast. Eventually, when your growth is just like when you extreme growth, it's not very hard to fundraise. But at Udemy, it was very hard to raise money in the early days because nobody believed in an online learning platform which does not have certification. Okay, so that was a really big challenge. And then we were immigrants; we did not really know anybody. My accent was a lot of kind of worse back in the day, so it was like there were all these things became actual friction. We eventually we were able to convince some angel investors. There was this first angel investor was called Russ Frayden and Keith Rebois were like the very first 2 investors, and they kind of their friends did our series, the angel round. And then again, like, early stages were hard, but then once our growth just started kicking in, so it became a lot easier over time. Yeah. So I think at Carbon, it's a different situation because by the time I started Carbon, Udemy was already a multi-billion-dollar business. So when you start one very successful company, like the next company fundraising, early stages become very easy. So the seed round, Series A was just existing investors I knew from Carbon, from Udemy. But despite my background, it was actually very hard to raise money after that because the Silicon Valley VCs by and large hated this idea of having actual physical locations. So they all wanted to invest in, I mean, they really honestly hated everything about the company, right? So they hated the fact that we have physical clinics. They hated the fact that we were not charging a premium fee. We were just making this working existing business model, right? So we're not it wasn't a higher price point item. It wasn't subscription based. It was just however healthcare works normally. It was going through insurance. They hated the fact that this was direct to consumer because the assumption was that it's impossible to make direct to consumer healthcare work. So you have to sell to employees. And they hated the fact that this was fee for service, which means we were not taking risk, which it was all the hype. And they hated that this was primary care, right? Because primary care is considered to be a completely unprofitable business, right? So because the de facto thing that investors want to invest was some virtual only specialty, like let's call like cardiology or like diabetes care that you sell to companies and you take risk on something and there's some sort of subscription play. So that's the type of like standard type of companies that they invest in. So, but to be honest, like it was kind of dumb, like the all the things, because like what they said they hated was majority of all care, right? So I mean, only 1 or 2% of the care was actually virtual. It was all physical, and primary care is more than half of all the visits, right? So yes, it's like it's lower margin, but like lower margin is not bad for technology companies. Usually, you want to operate in a lower margin business, otherwise you'll have a lot of competition, right? So I mean, this whole video-based care was interesting ideas, but again, it's probably, I mean, it does not really exist for mass market healthcare, right? It's only for really super kind of old high-risk patients. It's just like they had all the constraints on what they wanted to invest, and then direct-to-consumer, like versus enterprise, like I mean, in Silicon Valley, yes, companies do buy healthcare services for their employees and they pay a premium, but it doesn't happen by and large for the rest of the population. So so it's really like it was an unusual business because it was a business that it was assumed to just not be impossible. And actually, we were not really just coming up with some AI replacing physician type of Silicon Valley pitch. We were just saying we'll take however healthcare works today and just really redesign from the ground up and make it 10 times more efficient, 10 times better, right? And that pitch is not like the type of thing that investors want to hear. They want to hear AI replacing physicians, right? So yes, so it wasn't easy. Honestly, like I think we ran out of money completed at least in 2 different locations. So because we were like building clinics and we were like spending money on real stuff, so it wasn't just easy to make this a capital light business. But eventually, once the numbers started hitting, and I mean, we are growing so fast. Like I haven't given shared a lot of public numbers, but I mean, we are like people believe that having physical location is a bad idea because you cannot grow fast. That's the assumption. So that is the, I would say, like the like the kind of assumption which is not very smart, right? Because it's an anecdotal assumption that companies with physical retail footprints grow slowly. They just look at other companies and they said they grew slowly. So but that's just a simple analog thinking. We are growing a lot faster than Uber or like Twitter grew in their heydays, right? So it's just that the fact that you have physical locations doesn't mean you cannot grow fast. Like we had 7 clinics in 2019. We now have 52, right? So we are opening 2 clinics per week, and then next year we are going to have probably 400-500 clinics. So it's just these things are possible. You just have to plan to do it.
Right. Yeah, and I think what definitely strikes me is the fact that you definitely highlighted the sort of inefficiencies and operational gaps in healthcare, which definitely exist, and that fragmentation too. As a everybody's a patient at some point, right, in their life. Everyone's a consumer, and sort of filling those gaps and making that user experience or whatever you want to call it, patient experience, seamless from end to end. I mean, that's already huge. Like that already probably lowers the barrier to people seeking care, accessing care, doing all of that. So yeah, that sounds great. And that's very interesting, actually, that the investors did not want those certain outlines and variables because, I think there are always these buzzwords that are very trendy, right? Probably in the space, and you know this more than I do, but they probably didn't hear AI and they were like, oh, this is not an idea that we want. But I think thinking about the old school quote unquote problems and iterating on that is actually very smart. So yeah, that's awesome. And actually, we've had a couple questions probably to that end come in about monetization and revenue generation. So could you speak a little bit about how you are monetizing the services probably at Carbon Health, and particularly when you're talking about B2C driven revenues, business to consumer?
Yeah, honestly, like one of the things that I did in both companies, I kept monetization as simple as it could humanly be.
Mm-hmm.
At Udemy, it was very simple. We give you a course, you give us money.
Right.
Fairly straightforward. So, and then we eventually build an enterprise version. So that is subscription based. So it's a per member per month model, because when you are selling to enterprise, it's a lot easier for them to have a subscription model because they know they have a kind of fixed budget.
Mm.
And when you sell to companies, they don't want variable budget. They want to know exactly how much they're spending every year so they can budget that. But for consumers, it's the opposite. Like majority of the time, they do not like subscription. So for things that they use very frequently, like music or like TV, kind of like Netflix, so those things do make sense as a subscription model. But most of the time, consumers prefer just like paying for things directly transactionally.
Yeah.
And at Carbon, again, it was very simple. We did not really touch the business model. We just said, like, you can only know it on so many things. And I was very convinced that like what we had to innovate was that the tooling for doctors, the experience for the patients. So that's really what we wanted to do, can change the clinical care delivery. But we just kept the motivation, just like how it normally works. We collect insurance, somebody claim to insurance companies, get paid from them. If the patient has to pay a percentage of it, we do charge the patient. But it is exactly how you kind of pay for care everywhere. It's just more transparent, more like more clear. We are trying to be upfront about it, but the business model is pretty much the same with the doctor in your corner. We don't even charge a subscription fee, and we keep the cost extremely kind of affordable. It's really, I mean, there are Medicare reimbursement rates. We don't want to like get paid any more than that. So.
Okay. Yeah, gotcha. Yeah, and I think there are probably some other businesses and startups out there that do have this subscription sort of primary care model, at least that I've seen in New York, which is a different approach. So that's a different line of thinking. But on the topic of insurance, actually, we've had a question come in that says it's a little bit of a broad question. Was wondering if you could talk about the interactions that you've had with insurance, actually. Any stories there?
So our work relationship with insurance companies is actually pretty straightforward because so you negotiate with each insurance company and you get rates. When you're a small company, they usually give you like what in the industry we call it Medicare rates roughly. So Medicare has standard rates. And when you're a small provider, the insurance companies will just give you something just slightly less than that.
Okay.
If you're a large hospital system, you might be getting paid 3-4 times those rates, right? So there's a massive inequality in like how much insurance company pays for different groups. And again, everybody's business model is be larger, have more clinics, become a monopoly so that you can charge more to insurance companies.
Yeah.
So versus our model was, you know what, the rates they are giving us, we're happy with it, right? Because I do not want to charge any more than that, because even though it feels like you're charging insurance, not the patient, eventually you are charging that to the country, right? So when we say that the United States, we spend $2.5 trillion in care delivery alone, that's the money that you are charging. So if you charge more, healthcare becomes more expensive, and eventually, every time you're paying for an expensive healthcare provider, you're making healthcare less accessible for the next person, because those providers are sucking in more those expensive hospitals are sucking in more providers. And then they're actually, I mean, the number of doctors are fixed. The more doctors move into these expensive locations, the fewer doctors are available to the rest of the population. So we are very, like, I mean, it's one of the key ideas of Carbon is that we just don't want to charge any more than Medicare reimbursement rates. So when you do that, the nice thing about this model is now you don't really have to worry about the insurance companies because everybody's happy to pay you that amount. So essentially, we open clinics in any city in the country we want to, because when we go there and we say we just want these rates, and they're like, of course, like just take these rates. Like if this is all you're asking, like you're happy to give it all day. And similarly, we don't have to worry about politics because, I mean, whether it's the Democrats or whether it's like Ted Cruz or Bernie Sanders or like Biden, doesn't matter. They are all happy with paying Medicare reimbursement rates for high quality care. So yeah, it's just really, if you figure out how to operate within those existing really kind of reasonable cost structures, these things stop becoming risk factors.
Right. So that's the pricing actually then becomes a known variable, and you can just kind of design around that essentially. Yeah.
I mean, if you look at Amazon, right? Like this, it is big. I mean, in most industries, when you're profitable, you use it to reduce costs to make things accessible to more people. Healthcare has this weird dynamic where there isn't a true market force that is pushing providers to make their services cheaper and cheaper because payments are complicated. It goes through insurance. Because it's complicated, uh, end consumers don't know how to shop for care, which can incentivize the hospitals to just really push to charge as much as they can. So, but I think that that works if nobody's doing something to stop it.
Yeah.
So if we are trying to stop this in the long-term terms, even though patients don't know how to shop for healthcare, when your rates are lower and the patients have high deductible insurance plans and other stuff, and you're not causing them to go bankrupt, like they will eventually notice, right? So like even though they don't know this before the visit, you get much higher loyalty from your customers when you have reasonable costs and you never actually cause them to have severe economic damage for getting care. So, and I think that I believe like it's just the only way to fix this is some healthcare providers doing things differently and really causing significant competitive pressure to existing providers.
Yeah. Actually, you mentioned something that I was curious about personally, which is sort of the stickiness factor, or, how when you've sort of redesigned and put patients and providers at the forefront of healthcare at Carbon, do you
Yeah.
find that patients stick with their providers and stick with the system much longer than somebody who might jump ship? Is that something that you guys have measured?
Yes, exactly. We also bought some clinics because we bought those clinics. We have before and after Carbon data, so we can kind of compare apples to apple. Our loyalty is roughly 2.8. Like especially in these clinics we bought, their retention was just the same benchmark with the rest of the healthcare system. The retention went up by 2.8 times after in the first year.
Oh, wow.
So it's just I have graphs like to show that, but like all this cohort retention curves, and in the last 14 quarters in a row, we've been able to make the retention better and better. So actually, the more technology we build, the more services we build. It's just the stickiness of downloading our application, scanning your issues card, you book the appointment. The next time your medical records are accessible, we follow up with you. You see your medical, you pay your bills through there, and that kind of makes it so that next time you need care, it's just 5 seconds. It's right in front of you. So like, why would you go to any other doctor? So it's really like one of the reasons which made us and the investors were comfortable was seeing that our retention cohorts were just like uncomparable with other healthcare providers.
Yeah, definitely. So we've had lots of questions coming in, and we're heading into our last 10 minutes or so. So I'm going to keep an eye on the time, not to rush you. But Alan, Dr. Resnick, thank you for your question. He would like you, Eren, to talk a little bit more about the two biggest changes between conventional medications or prescriptions and their system that saves costs, and also how you handle the causes of defensive medicine and medical liability.
Yes. So let's start with the defensive medicine, right? So this is the idea is that the suggestion is that doctors overprescribe diagnoses or referrals because there's no cost to them doing it, and if they don't, like they might be more liable for kind of more care. So that is so. First of all, a lot of things that I think sometimes there's a lot of skeptical thinking for doctors, which I usually disagree with, right? For example, a lot of people think doctors would prefer you coming back to the office multiple times just so that they can charge more. That is, I think, by and large, just false, right? Yeah. So, like these are well-educated people who have an alt and who do care about people, like they like who don't really want to charge you any more than needed, right? But there are certain dynamics which cause them. So this whole malpractice risk is one of those considerations. So the solution for us was one, instead of just over-diagnosing and over-treating patients, let's just follow up with everybody after the visit and see whether they're recovering as we're expecting. And if they're not, that's actually a good trigger, input data to just kind of switch to the next round of care for them. So I think instead of just over-treating, we are starting the first treatment. And usually in the notes, we put that like, if this doesn't work, we might just go to this other next level of treatment. But we check back with you, like every care plan we publish has a productized follow-up schedule. So our bot automatically follows up with you. So if you have upper respiratory infection, 10 days later after your symptom onset, we expect your symptoms to disappear completely, right? But if it doesn't, that might be a signal for something more severe, right? So, and then we follow up with you. And again, we follow up with 100% of all patients. And then if you're not recovering as expected, it automatically creates a task for the provider to look at the case again, and just very quickly they might just put up more orders and publish a different care plan. So that's actually a big part of it. And the other part of it is, so there are some bad actors in the malpractice world trying to kind of look for cases. But after, I mean, we have close to 1 million patients at this point. We have zero malpractices so far. And I think part of it is that good like, I mean, if you just remove people who might be actual poor bad actors trying to just like extract money, right? So I think a lot of the time, like people get really frustrated because the communication breaks down. So it's not like, because like sometimes the diagnosis you put ends up becoming the wrong diagnosis, and like we had a lot of situations where things got escalated, patients had to go to ICUs and everything, and like our doctors had to follow up with them, and we wish like we hadn't missed something, right? So and we usually kind of learn from them and productize it, so the next time we are not going to miss the same thing. But we're also being very open about the communication of it. So generally, obviously, like our experience is that patients really appreciate it, even things go bad like that, when you show empathy to their problems. So I think again, like this is like if you have a very open direct communication line plus following up automatically with using technology, those things actually have made this not a problem for us.
Yeah, definitely. Awesome. Another a more technical question actually comes to us from John. Thanks, John. How do you manage compliance regarding electronic medical records? Is that a risk factor by any chance in the business model?
No, I mean, we built the entire technology stack from the ground up. So one of the first things we had observed about traditional healthcare is a typical practice uses around 10 to 15 different point solutions. They have a scheduling system. They might be using ZocDoc for certain stuff. They have an EHR and a practice management system, a messaging tool, and a video visit, and a patient collection tool. Like it just goes on, like the supply management tool. So, and that obviously does not work if you want to have high frequency, scaled, kind of good experience. So we just collapse everything into one piece of software. So the patients and provider, they both use just Carbon Health platform. Even between patient and provider, it's really the same software with different users. So, but if you think about it, like Apple, like Tesla, Airbnb, these are not, like Uber is not using 20 different tools. They are not using a dispatch software and a scheduling software and a payment tool. Like it's just one piece of software. So similarly, it's just one piece of software. So we designed to be extremely secure from the ground up. All the patient privacy, security. These were like, I mean, honestly, those are well understood problems. So it hasn't been a problem. And in our case, like, we're not really pushing the boundaries too much on compliance. Like we're not, I don't know, prescribing kind of erectile dysfunction medication just quickly. It's not that type of like thing that sounds like you're just like cutting things a little too short. So we're just, I mean, we're following probably compliance far more strictly than any other healthcare provider.
Yep. And so we actually have a few higher level questions for you now in the last few minutes from Richard. Thank you, Richard. Richard says, in both education and the healthcare industry, there are system inertia from traditional institutions. How do you overcome that? And more specifically, maybe about data privacy and governance are now major concerns. How do you deal with that?
Yeah, so I actually think, I mean, look, the way we overcame it in my companies, we just competed with the traditional providers. So we did not sell to them, right? So the inertia is very real. It's a lot worse in healthcare than even is for education. The problem with healthcare is, like, I mean, just you're you're buying software as a healthcare provider. If you are buying software, which is your core infrastructure, like you can't afford to change it easily. So there's a lot of like migrating from one electronic health record system to another one, even for a small practice, it's a 1-year process. For a hospital, it's usually a 3-4 year process, which costs like several $100 million. So if a hospital hasn't seen your company around for 3 or 4 years at least, they're not gonna actually use you, right? So that it is a reality. You just have to, I mean, if you want to sell software, you have to be ready to survive for 3, 4, 5 years before people are really taking a chance with you. So I would say at least 3 years is almost like a minimum requirement. So because like they can't afford to have you be a pilot with you get all our doctors to kind of get used to your system, and then 2 years later your idea doesn't work, you shut down, you pivot, and like it's really tough, and you just have to embrace that reality. So I think the solution is probably starting from an angle where you're not building mission critical software, and you're kind of complementary and optional, and you just do the small scale and slowly grab it. So you like, if you want to start a software, especially healthcare software business, you need to give yourself at least 5 years before things are becoming real. So again, I think like the counterintuitive thing about what we did at Carbon Health was, if you're not selling software to existing legacy systems, the fact that they're slow becomes our competitive advantage, because we are going 100 times faster than them in building these solutions. So their slowness was our, I mean, sometimes when an industry doesn't embrace technology, the best solution is just compete with them.
Yeah. Awesome. Um, and a similar sort of uh, question, but actually now commenting on the differences. So, what are the key differences in building a skill training platform like Udemy versus a healthcare platform, since you've experienced with both?
Yeah, yeah, honestly, I mean, their mission was somewhat relevant. The product ended up being very different. Like Udemy is a product business. Like, so by and large, you're buying a course, consuming it. Carbon Health is a service business, just like pretty much all healthcare. So as I think the service business has different dynamics than product business. The operations are far more complicated. So I mean, at Udemy, I never understood what operations really mean. So, like what is it like? What is a good operator? Like that was kind of a foreign word for me. And now at Carbon, I just truly appreciate how important operations is. Like essentially making everything work like a clock is not easy. So it's not a pure software challenge in that. And also at Carbon, um, I guess like we had to nail far more disciplines to become successful. Okay, so we had to be really good at the technology side, the clinical side, operations, finance, right? So if you don't watch your numbers very closely in a tight margin business, you're gonna lose all the margins immediately when you stop looking at it. So the people side, the culture was extremely important for Carbon. Like it's important for every company, but in our case, like the care you receive is really coming from humans. So that was very critical. So it's really at Carbon, I think I had to learn far more disciplines, like from again finance, people, culture, technology, operations, and versus at Udemy, like I was really just focused on one or two fields, and that was kind of good enough to make this company successful.
Right. Okay, awesome. So we are getting towards the end of time. So I actually just wanted to, and thank you so much for all of your questions, everybody. This has been very engaging and super fun, actually. Eren, do you have any sort of final thoughts or any concluding remarks that you want to share with everybody before we hop off?
Yeah, but I would just say like a lot of people are getting overly worried about things like regulations in healthcare, and honestly, I would just say those are not the problem. So the problem is like there are a lot of problems to solve, and you just kind of, I mean, yeah, the only challenge with healthcare is that the bar is higher, so you need to be better resourced, and you need to give yourself more time before things are working or not working. But other than that, I think like I'm really happy that in the last couple of years, there are far more people working on healthcare right now. So I think that's actually, I think the side effect of the pandemic is going to be having 10 times more people who are interested in healthcare space. And as a result, I think 10 years later, we'll actually have like a net positive impact from pandemic. So I think I'm excited about how the world is going to change over the next 5-10 years.
Yeah, we can only hope. With that, we are at the top of the hour. I'm very sorry, truly, if we didn't get to your questions, but we may have to have a part two with you, Eren, for next time. Thank you all so much for your engagement and for tuning in. Eren, thank you so much for your time and for sharing your story with us. We'll hope to see you again on this forum soon. And in the meantime, have a great night, everybody. And thank you for tuning in. See you next time.
Uh,
Bye.